Advisor to the Ministry of Health, Dr. Patrick Martin, dialogued with members of the news media concerning the plan to address violence as a public health issue. Dr. Martin pointed out that success depends on several interrelated areas, agencies, and communities, making the point that tackling violence as a public health matter involves many coordinated and integrated approaches.
This is not a police matter only. I think our country has generally come to that. This is not a political directorate matter only. It's all of society. There have been non-governmental agencies that have been assisting the government agencies and also working by themselves to assist their church groups. It's multidisciplinary. Violence is learned behavior. What is learned can be unlearned if we can intervene early. We're talking about early childhood, which extends up to period of age 8. You can unlearn, you can deconstruct and then reconstruct. Yes, it can happen in the teenage period, but it's more difficult and it's infinite. It is infinitely more difficult after the teenage period. The best time to intervene is before age 8, up to about early adolescence.
Laying out key issues, Dr. Martin reflected that some components of the new direction already exist as part of public health principles and strategies. What is necessary, he indicated, was a coordinated and focused approach specific to the issue of violence.
The government has established a task force. 3 primary interventions were recommended coming out of the symposium, informed by public health. 1, to interrupt transmission, meaning, and this has been successfully done in places like Chicago, hotbed for youth violence, especially among black people. Wherever you see hotspots, you put credible influencers there to meet persons one-on-one or to meet groups one-on-one to try to diffuse things early. That's interrupting transmission. B, preventing further spread among the exposed. So remember I referred to, we know that violence is a learned behavior and the number 1 classroom is the home. So get into those homes early, identify, work with the families, using behavior change interventions. The third one is changing behavior norms. This refers to what is your policy and program environment in relation to justice and peace and equity and human rights and shelter and food and all those kinds of things. If these 3 interventions sound familiar, they should be familiar because these interventions were part of the public health toolkit to mitigate COVID and HIV and measles and smallpox and tuberculosis.
The SKNLP-led administration said it is committed to adding this approach aimed at achieving positive results among youth years from now. Glenn Bart reporting for SK Newsline.